Thank you so much for being here. My name is Gideon Orbach. I practice chiropractic here at the World of Wellness. Previous to the World of Wellness, same building, same people, different name. We were the Weiner Wellness Center. Previous to that, different building, same people. We were on the south side of Pittsburgh. It was the Pain Release Clinic. So I've been here for quite a while. I'm more than 15 years in with this group. I'm more than 21 years into my career practicing chiropractic. I'm actually 108 years old. It doesn't quite look like that because I take some pretty good vitamins and minerals and nutrition. And you best believe, I know where the bodies are buried. But instead of going through that, I think today would be a better day to talk about the treasure hiding in plain view. So, anyway, as I said, I practice chiropractic. I hold the distinction of being a primary spinal practitioner. That was a certification program that I did through the physical therapy department at the University of Pittsburgh. And if you know me, you know that I bleed blue and gold. Sometimes, like I cut myself shaving. I didn't this morning, fortunately. A little blue fluid comes out, little gold fluid comes out. That's pit for you. And when that happens, I don't want to get an infection. So I know this presentation today is supposed to be about my favorite formulas, and we're going to talk, certainly we're going to talk about chiropractic, and we're going to talk about rehab and low tech stuff, and but we're going to do a much deeper dive into the nutritional component of what I do today. So as I said, I'm glad I didn't cut myself shaving and have blue and gold stains all over my face and my tie. But when I do, I use colloidal silver as an aftershave to prevent infection. So one of the things, a little shameless plug, I'm big on those. Shameless plug for colloidal silver. I really like the Argentine 23 that we carry here, and I use it as an aftershave. If I cut myself, I put a little bit on. If you cut yourself or nick yourself, I can't emphasize this enough. We want to do antimicrobial things. We want to prevent infections. So that's my shameless plug for Argentine 23. But I'm standing up here like we're doing the microphone check and the audio visual check, and IT savant Phil is over here to my right. You can't see him, but he's giving me a hard time about things that I've said in the past and things that he anticipates me saying in the future. And we're sharing a good laugh. And members of my audience crowd friend group up in front of me are, they're poking the bear a little bit and telling me things that they want to hear and expressing some concerns. And we were really on the verge of having a very interesting conversation, and I thought, like, oh, this can wait like 2 minutes, and we'll include the whole presentation in on this really interesting conversation. And the point is brought up, like, what are parents doing these days? How are people taking care of themselves? If you don't want to subject your child to the medical machine and you want to be more involved with a natural house, a natural household, where do you send your kids to school, and where do you who do you let them hang out with, and who's your doctor going to be, and who's going to sign important forms for you? I mean, look, I would love to, but as a practicing chiropractor in the state of Pennsylvania, I have a very narrow scope of practice, and I can't make big promises and sign forms that will allow your children or you to be exempt from certain social popular conventions that government seems to be insisting upon. How do we go about doing this? And the back and forth was it's amazing. It's absolutely amazing to me how resilient people are, and their quest for survival, and their eyes on the prize. I'm not going to let this get me down. I'm going to be able to make my way in the world no matter what obstacles might be in front of me. So I'd like to pose a question to my in-person audience. And also, we're broadcasting. Are we live on Facebook? We're live on Facebook. I don't know any other platforms. We might be being broadcast all over the place, but I know. Sorry. Oh, we're on YouTube also. Hi, YouTubers. So, anyhow, I got a question that I'm posing to everybody who's out there, and you can type in your answer virtually, and you can call out if you're here. But what does it mean to be healthy? All of us come to a facility like this to eat. And shameless plug for Mr. Z. We got some pretty healthy food in the food truck out in the parking lot. God knows our nutrition store here. I mean, in terms of square footage, in terms of number of products, diversity of products, quality of products, I would go so far as to say we are at least as good, if not better, than a really good sized GNC. People come here because they want to be healthy. They want to learn strategies to be healthier. Oh, I get that. I'm on board with that. I want the same thing for myself and for my family. What does it mean to be healthy? Would any brave soul out there, live in person or out in virtual land, like to maybe kick around an idea? What is the word health? Define it. What does it mean to you? Anybody? Going once. Going for, oh, yes, please. It means a lot of things. I love that. I love that. I'm gonna cut you off and repeat into the microphone and then give it back to you for the sake of the people remote. But the very astute answer was having the ability to function every day. And all right, and I've been limited until I started coming here and getting products that make me feel young again. Do I have that right? Yes, yes. Now we've I don't know. I'm sure I recognize your face. We've crossed paths in here, but we've never really formally met. I don't think you've ever been one of my patients. I joke around. I got a lot of people on payroll to say good things about me and good things about what we do here. They're out roaming. Now, if you bump into somebody on the street and they're just talking casually with my chiropractor's Orbach, he does wonders for me. There's a good chance I've never met that person, but I have them on payroll. I should put you on payroll for this. That is just an absolutely wonderful testimonial for you to say how much benefit you derive from the products that we have. I really cut you off. Do you want to continue? Okay, that's thank you. Thank you so much. They pay sleep well. That's you're right. You're right. And to have energy. I think you hit the nail on the head and you pounded it with that sleep well because that's when our body repairs itself and that's where we rejuvenate ourselves. And if we're taking all of the best products that we can find in all of the land, we still have to digest them and absorb them and distribute them throughout our bodies. And so much of that occurs while we're sleeping. You're absolutely right. Now, I've been thinking about this for a very long time. I didn't ask this question randomly. This is something that we talk about at chiropractic workshops. As I meant, good God, 21 years of doing this. Can you believe that? I'm not a kid anymore. But what does it mean to be healthy? The best definitions that I've kind of heard and then kind of fused together and assimilated, and the way I present this is being healthy means you have the ability to recognize, interact with, adapt to and overcome your environment both internally and externally. So what's our internal environment that we gotta recognize and adapt to and overcome? Well, if you're putting great high quality superior nutrients that make you feel young again into your body, well, we don't really have to fight with them. But if we are putting, I'm sorry, I like the Brighton hot dog people so much. They're such a nice couple, but I do have to pick on them because they sell hot dogs. If we're eating Brighton Hot Dog Shop is a one building over from us. Um, we drove the Burger King out of business. Have you ever seen a fast food franchise close? There was a Burger King across the street from us, and now they're closed. I think we won. But anyhow, if you're eating at Burger King, if you're eating at McDonald's, if you're eating Brighton Hot Dog Shop hot dogs, your body has to fight with those chemicals. You're internally at war. Your internal environment is saying, "What are you doing to me? How do I get this out of me?" So that's body chemistry inside. That's our internal environment. We're recognizing what we're putting in, and then let's make a critical decision. Do we want to adapt to these hot dogs and the nitrites and the God only knows what's in there? Do we want to adapt to that and assimilate it into our body system? Or do we want to find a way to expel that as quickly as possible? And what are we going to do about the excuse me, what are we going to do about the metabolic toxins that build up in our digestive tract, in our liver, in our circulatory system, stemming from eating food of the pseudo food of that caliber, of that quality? That's just bad news. So let's do this. Let's take a company trip over to Kennywood and ride the roller coasters. And in between roller coaster rides, Some of us are gonna eat I don't know, let's all eat nachos. It's a summer day, what the anyway. So we're eating these nachos, and for good measure, let's dip our nachos into that pseudo cheese sauce, and let's go back onto the roller coasters. Now, I know you've all heard the term shaken but not stirred, right? So we have nachos with pseudo cheese shaking up, but not necessarily stirring inside of us. And we're doing our body the disservice of further shaking it by going on roller coasters. Some of us are going to have an exercise in regurgitation. You know what that means? Some of us are going to hold on to that stuff. Exercise in regurgitation, people. I would say here's a concept trap. Who's healthier? I would suggest to you the people who puke those toxins right out are in better shape than the people who can hold on to those toxins and let them make residence in their bodies. What do you guys think? Nod your heads. You can shake your heads. We can talk about it. So, this is our internal environment. What is our external environment? Well, my external environment is all of you people. Your external environment includes me. Now, I've noticed, you can't miss this, there are two people sitting right next to each other, sitting here in the audience, and not once have they bumped into each other. What's that about? Your brain has the ability, what's called proprioception. We talked about this in great detail on Monday, but proprioception is essentially your body's and your brain's ability to communicate with each other and maintain your position in space. Part of that, a big part of that is keeping your eyes level with the horizon. Big part of that. It's amazing. We're not walking around bumping into each other because we have good proprioception. We're able to manage our external environment. If you've ever had the experience of driving in the left-hand lane, let's just say for the sake of this conversation that the speed limit is 55 miles per hour. There's no speed limit on the Autobahn. Are you kidding me? I'm doing 70. I'm doing 75. I look up into my rear view mirror and I see somebody behind me who's gaining on me fast. What are my choices? Well, I can just stay there and say, "Look, man, I'm doing 75. It's a 55. Deal with it." Or, you know what else I could do? I could just be a good sport. I'm gonna merge over into the right lane, assuming that there's nobody there to collide with, and because my proprioception, my ability to keep my eyes level with the horizon is at least good enough that I can look over and glance into the right-hand lane and know it's safe to merge over. So I move over, and I let this person who is behind me going much faster than me off into the distance. They're a blur. I'm cool. There's no one in front of me. I'm just going to stay where I'm at. I am managing my body position and my car position in space relative to the external environment. You guys understand what I'm getting at? That's health. Health is being able to recognize what's going on around you and in you and adapt to it and overcome it. Piece of cake, right? Okay, so that's what we're looking at from a societal perspective, where we're worried about where are we going to send our children to school? How are we going to keep them safe from medical intervention that we don't desire that they have? How are we going to funnel them into programs that we want them to be involved with? Well, our conversation before the workshop was the way families are forming coalitions and somebody's parent is especially good at math, and I'm gonna homeschool my kid, and I'm gonna teach my kid and the other kid and the guy across town, come over to my house on Wednesday mornings, and we're gonna work on math. Maybe today is arithmetic, and tomorrow might be algebra. I don't know, but you're gonna learn math at my house. I don't like reading. I don't enjoy reading books. I mean, I see people always have a book in their lap, another one in their bag, 2 more in their backpack, always with a book. I don't enjoy that. I don't begrudge anybody. I'm not a reader. I'm more of a textbook, article, journal kind of guy. So, like reading comprehension, I know how important that is. I really do. I was a liberal arts major in college. I don't know how that worked out, but it worked. So, I recognize the importance, so I'm outsourcing my kid over to your house so you can teach them how to read and think critically and ask questions about what they're reading and discuss it. Now we have a coalition, and guess what? There's somebody else in the group who you're not gonna believe incredible. John's dad had a tryout in the NBA. I mean, he didn't make it, but do you know how good you have to be just to get a tryout? He's gonna teach our kids physical fitness and basketball, and we're gonna have him in the coalition to teach gym. Hey, those people have an enormous backyard, it's way too big. Let's figure out how to plant a little garden and teach all the kids how to grow some vegetables. That's how people are surviving. That's one of the things that I talk to my patients about. I can't say every day. I can't say every day, but certainly every week I have a conversation with people who have school-age children who are telling me about what they're doing, what they're not doing, who they're involved with, how they're trying to get out from under certain hardships that may be, hanging over their head that they don't wanna be involved with, and I have a tremendous amount of respect for people who just, man, they figured out how to get themselves from point A to point B on their terms, and they figured out how to do it without drawing too much unnecessary attention to themselves. And to me, those are some of the healthiest people you'll ever meet. You know, they're a couple pounds overweight. So what? They have a little acne on their face, even if they're in their mid 30s because they're eating too many acidic foods and disrupting their internal. So what? They're absolutely navigating their way through their external environment and probably their internal environment in a very, very self advantageous kind of way. So, once again, I just want to say how my deep appreciation for the people who engage me in these type of conversations. And I know this workshop is geared towards nutrition associated with calming down the nervous system and supporting body health and all sorts of good stuff like that. I mean, that was the title of the talk, and that's exactly what we're going to get into. So I don't feel for a second like this workshop or this conversation or presentation has been hijacked so much as I feel like somebody brought up a really, really important and interesting point that I think other people out there, whether they're seated in this room, whether they're eavesdropping from the nutrition store, because I'm not used to speaking with a microphone. Nobody hears me all over the place. And whether they're on Facebook or YouTube, who knows? I don't know. These are just things that need to come up. And if we're getting people to think about things and to consider what's going on around them, I declare victory. Even bigger victory than driving Burger King out from our our intersection. Okay, so as I told you guys at the very beginning, I practice chiropractic. My kung fu, my physical technique involves both spinal and extremity adjusting. I'm a hands-on guy. First and foremost, I use my mind. We have a conversation. We figure out what it is that's going on with you, the patient, what you want to get out of your interaction with me, what I can help you with. And I got a list in my mind, the patient, I'm taking a history from a patient, and I'm asking myself, what are all the things that can cause this? Why is okay, then you got that too. Is there a big overlap? Oh, yes, yes, there's a big overlap. We got one cause, two problems. Okay, I get it. All right. Anything that stimulates this problem has been stimulated, or anything that would checks and balance and cancel out this problem has been eliminated. So these are the things that I'm thinking about when I'm talking to my patients, analyzing what they tell me as to how I want to go about helping them hopefully solve, at least make better their problems. So I do hands-on chiropractic adjusting to the spine and the extremities. I am an old school guy. I use techniques that Russian bone setters were using probably thousands of years ago, that kung fu masters, that indigenous people all over the world were using thousands of years ago. I do not use a lot of high-tech equipment at all. Um, the techniques that I use have stood the test of time. I'm proud of what I do, and I'm not slamming or slandering anybody who does anything different. I just like the way I practice, and that's the way I practice this way. So I do hands-on chiropractic adjusting, spine and extremities. I do a stretching technique that involves disabling a neurological reflex, allowing people to stretch just a little bit further into their range of motion. So there's flexibility is a big component of what I do. I also do a little bit of trigger point muscle therapy where I do hands-on manual thumb. If it's really, really an awkward angle or difficult, I might put an elbow in between somebody's shoulder blades. Nobody likes that very much, but they all appreciate it. So we get tight muscles to relax. We get tight muscles to stretch, activate the properties of the tendon that allow it to heal, and we mobilize stuck joints. And the whole principle, and if you're really curious about this and you want to take a deeper dive on it with me, this is what we talked about on Monday. I cordially invite you to watch the presentation from Monday where I go into a lot of extra detail. If you have ambiguities about it, or if you have specific questions, or you want to learn more, I invite you to reach out to me through Messenger on my private Facebook page. Um, but I want to make sure that we have time to really get more into some nutrition and less into neurology today. And so That's the way I practice. Now, I thought I was really doing like, I'm just fine. I'm not on cruise control, but I'm certainly in a comfort zone, having been practicing the same way for so many years. But I recognize there were a few things that, look, I gotta be better at this aspect of examination. I gotta be a little better at correlating a few ideas, and I really I really wanna learn more about what other people are doing and see if there's something that I don't know about that I wanna integrate into my own practice, and that's why I did this program at Pitt, the primary spinal practitioner program, which it was great. I mean, it was the first program of its kind where chiropractors and physical therapists and even doctors of osteopathic physicians, DOs, were in the same classroom. The people who do hands-on, they called it manipulative sciences. And I kind of like that, hands-on manipulative sciences. So at the beginning of my career, I would meet with a patient and they would say, don't tell anybody, but I'm in physical therapy. And like, "Well, what's wrong with" my physical therapist said, "Don't go to a chiropractor." They campaigned hard, 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 hard against us. All right, I get it. We're in a turf war. We're trying to use our own pathways to treat the same patient population. And guess what? I'm kind of antagonistic to physical therapy. And then, like, I actually finally got to meet some physical therapists, and they're awesome. They're absolutely awesome. Why were they campaigning against us? Why are we campaigning against them? Why are we not sharing? Well, here we are sharing now. So, anyhow, that's the background. Now, when I treat patients, depending on their condition, depending on their personal individual challenges, two things that I should do 100% of the time, but I don't, and I do, I would say, most of the time, is we talk about exercises that might rehab or exercises that might support the treatment that they're getting, and we talk about nutrition that might support the treatment that they're getting. So because because I work with people who have such a superior understanding of nutrition, like I'm pretty good to help you with that front level of nutrition and maybe to lay a foundation. But if you really want to get deep into it, I'm not your guy. You want to talk to Jeffrey Nisnik, maybe to Joe Messino, even if you can capture Jamie Dorley for a moment and have a conversation with him. Those people are much better nutritionists than I am, and we even, depending on what somebody might be challenged with, we even refer to nutritionists that don't work here. I'm not, look, we don't have to keep it under this roof. We don't have to dominate or monopolize somebody. If you're going to have a better experience with somebody else, you best believe I'm going to steer you to that somebody else. I have, I'll name drop for a second. I think Ashley Rozzi is fantastic. I think David Sass is even better than fantastic. And when I treat patients who tell me, oh, Dr. Sass does my nutrition, I think good. One less thing for me to worry about. He's awesome. But anyhow, be that as it may, let's first level, let's talk about the patients that I treat. My patients have neuromusculoskeletal injuries. They're musculoskeletal conditions. The muscles connect to tendons, tendons connect to bone. Where two bones come together, we have a joint. The joint is supported by ligaments. Ligaments connect bone to bone. Muscles have beginnings and endings and definite shapes. There's some pretty funny shapes if you study anatomy, but they're definitely finite and shapeful. And so, where one muscle lies on top of another muscle, we can't have them stick to each other. That would limit range of motion. So, there's a very, very well lubricated film of something similar to skin or maybe even similar to saran wrap called fascia. And the fascia lives in between layers of muscle, allowing muscles to slide or to glide on top of one another. And sometimes, like, there's a pathology. That pathology might be dehydration, it might be a bruise, it might be mechanical pressure, it might be a overuse sprain strain, and the muscle starts to fatigue and spasm, and it sticks itself to that fascia in that particular spot. Now, the muscle has a definite beginning, ending, and a shape, but the fascia is continuous, much longer and much bigger than the muscle. So the muscle sticks to the fascia, and then the fascia is going to stick to the next muscle underneath it. And we're going to have a place where two muscles don't really slide and glide with each other the way they're supposed to. And we're going to call that spot a trigger point. So you push on one of those trigger points. Oh my God, I'm going to push right here. And the patient says, wow, I feel that all the way down to my fingers. Oh my God, what is that? Well, that's that fascia, that sleeve of fascia being pulled to interface with the free nerve endings that slide along with it, creating sensation all the way down to the arm. And you think about that fascia as being a like a ball of saran wrap, and we're going to unfurl the ball and flatten it out and smoothen it out and get the muscles to move the way they're supposed to. And we're going to get the joints to open and close or rotate with each other and move through their comprehensive range of motion. And all of those little adhesions and losses of range of motion and changes in musculoskeletal dynamic, they make imprints into the nervous system. So I like to ask, here's one of the questions I really like. Can you ride a bike? Why, yes, Dr. Orbach, I can ride a bike. I had one when I was 12. And I was, let me scan through. Oh, well, you're 47 now. So you had a bike when you were 12. So 35 years ago. Have you ridden a bike in the last 35? Well, no. So if I got our bike out of the basement and set you loose in the parking lot, I'm guessing the first lap around would be really wobbly and ugly, but you'd make it. And the second lap would be just a little bit better. And the third lap, you're ready for the street now, like that memory kicked in, right? So that's muscle memory. I mean, I think all of you can relate to that experience with the bicycle. I mean, maybe you're just on one yesterday and it doesn't apply to you, but surely you know people who haven't ridden a bike since childhood and what their experience would be if they got right back on one. So there's even a cliche about how you never forget how to ride a bike. That's brain body communication. That's having the muscle memory to be able to ride a bike. So if I go for a really vigorous workout, far, far more vigorous than what I'm normal and naturally used to. Or if I, for some strange reason, decide to climb up on the ladder to work on my roof, and I'm standing on the ladder and the rung is this big, but my foot overlaps and this is digging into me, creating like a compression in the bottom of my foot, forcing me to rock back and forth like this on the ladder to maintain my balance and my comfort and juggle the two. I'm going to have some pain. And I'm working on the roof. I'm standing on the ladder and I'm hammering the shingle in place. And now like I'm okay. I can go to the gym and lift a few weights, and my body's used to that. My body's not used to this. This is a very strange, awkward angle for me. I'm going to develop a sprain, strain, overuse, repetitive type of injury. You guys all on board with that? Got a rough idea of what I'm talking about? Those are the patients that I treat. People who have, well, let's see, the joints in my wrist as I hammer, the joints in my elbow as I hammer, the joints in my shoulder as I stabilize myself, the joints in my ankle as I rock back, my foot as I rock back and forth on my ankle, and my heel trying to keep myself comfortable on that top rung and yet maintain my balance. Because God knows I really don't want to fall off the ladder, and neither do you. Nobody wants that. So, anyhow, all of that's going on, and I'm straining muscles and I'm spraining ligaments and I'm tightening and winding and adhesing my fascia and I'm limiting ranges of motion those are the patients that I treat. That's where I excel. Um, so what will we do physically for them? Well, we do a series of chiropractic adjustments, stretching, trigger point therapy, maybe a little bit of low tech rehab. In fact, let's do a moment of low tech rehab right now. Number one exercise on my checklist is deep breathing. We are all angry about something. Let's protest. Let's march in the streets. That's not going to do the trick. I'll tell you what, some of us will go on a hunger strike, some of us will go on a thirst strike, and some of us will just hold our breath until we get our way. Who's going to fold first? I'm going to suggest to you that we can go a lot longer without food or drink than a deep breath. So everybody, I want you all to sit up straight and tall in your chairs. I want you to impress me with your perfect chiropractic posture. Head is up tall, shoulders are back and down. We are not shrugging our shoulders up to our shoulders, to our ears, but we're keeping them rocked backwards. I want you all to take a deep breath in through your noses. Feel your chest expanding. Hold some more, and blow out through your mouths. All right, again, another big deep breath in through your nose. We're holding some more. Let's hold again, and let's blow out through our mouths. Again, big deep breath in through your nose. Everything is expanding. We are not shrugging our shoulders up. We're relaxing them down behind us, and let's blow out through our mouths. Very good. So this is what, 3 deep breaths in a row. I doubt it even took us a minute, but we're actually getting, I don't know how much oxygen we're getting in. I don't have a tool to measure it for each and every single one of you individually, but I feel very safe in assuring you that that's more than you're used to with your usual breath. Took us, what, 49 seconds to do 3 deep breaths? What would be wrong with taking a minute 5 times a day to do a deep breathing exercise to flood your body with delicious oxygen? Let's do another one. This is another one of that. The deep breathing is the most important low tech exercise I can possibly suggest for you. But let's do another one that depending on the condition, it's certainly not the most important, but it's near the top of the checklist for a lot of different conditions. So, what I want everybody to do is put their feet flat on the floor, and I want your toes facing 12 o'clock due north in front of you. So I don't want this. If you can see how my right hand is mimicking my foot and rotating out, and I don't want this, I don't want them to rotate in. I want straight north. And what we're going to do is we're going to take our right heel and dig deep into the ground with it so our toes are up in the air. And then we're going to, on our left foot, we're going to put our tiptoes into the ground so our heel is up in the air. And we're going to switch and switch and switch again. And you can do this at ballroom dancing class, weddings, bar mitzvahs when the band comes out. Switch and switch. And I want you to emphasize maximum range of motion. I want you to think about bringing your toes up so high you could scratch your kneecap with them. I want you up on your tiptoes so high that if a doctor measured you with that device coming out of the top of the scale, you would be at least 8 inches taller than your normal height. So what are we doing here? There are 28 bones in each foot. There are 206 bones in the human body. There are 28 in each foot. Of those 28, 26 of them are movable. By movable, to me, that means adjustable. 2 of them are fused on the bottom of the big toe to protect an important tendon that runs through the groove. So if somebody had, say, an inflammatory condition of their plantar fascia, if somebody were rehabbing a sprained ankle, if somebody had bunions, if somebody had hammer toes, if somebody had any number of a tarsal tunnel, any number of foot injuries, be a good place to begin some rehab is just to get your bones of your feet to move through the ranges of motion that they're designed for on the planes of motion that they're designed to move. So that's why that 12 o'clock position is so important. And when one starts to drift out to their right a little bit or to their left a little bit, they're going to upset the dynamics of what's really supposed to happen. And we don't want to do exercises to reinforce wrong stuff. We want to do the right stuff. So that's why 12 o'clock is so important. Maximum range of motion is so important. You guys cool with that? So what are we going to do? We talk about all these injuries in the foot or foot conditions or foot symptoms that we would do this for. Remember at the very beginning when I highlighted how we have these 2 people sitting so close to each other, right next to each other, and they don't bump into each other? It's amazing. It's amazing. Everybody is in ownership of their personal space and being respectful of somebody else's personal space and boundaries because of good proprioception, because they have the ability to orient their bodies in space. But we got to look at that as something that we have to cultivate. We have to continue to work on our proprioception. We have to work on our balance. We have to challenge it to make it better. What if I had absolutely nothing wrong with my feet? What if I don't have a foot injury? What if I don't have sprained ankles or plantar fasciitis or hammer toes? What if I just want to work on an exercise that involves good coordination to challenge my brain to better coordinate my brain and my body in an area that I'm unused to using? This would be a pretty good example of an exercise to do. In fact, I have one of my current patients is recovering from having had a stroke. It's a very, very serious neurological injury. I do not know how much function we're going to be able to get back, but we're going to get as much of it as we can. And one of the things I have him doing is this very exercise that we're talking about. He can sit in his chair. He's at no risk to fall and do a balanced, coordinated exercise at the same time. All right. The comment from my friends up front say that they are in agreement. It feels good. I think so too. I enjoy it. I enjoy these little low tech exercises. All right. So nutritionally, we want to have good range of motion at our joints. So I highly, highly recommend lubricating them. We can't stick a can of WD-40 into our ankle mortise. That means the hinge of our ankle joint, spray it and hope for the best. So I kind of like the hyaluronic acid, HA+. Now, In research laboratories, under pristine conditions, with every variable accounted for, hyaluronic acid is shown to help rebuild cartilage. It's true. In real human beings, where every variable can't be accounted for, and there might be factors that slow healing, such as inflammation, for example, such as a buildup of free radicals, such as any other kind of metabolic toxin that 100% of the human being population produces. I don't like always and never statements. I'm very careful about saying always, never, 100%, 0%. But I'll go 100% on this one. Human beings produce toxins in their bodies. Under those conditions, I'm skeptical that the HA plus, that the hyaluronic acid will regrow cartilage. It might, but I'm not going to bet on it. But what I will bet on it is that the HA plus will help to lubricate joints and to help ease the range of motion and help to extend and increase ranges of motion and help you to be able to move a little bit more fluidly and a little bit more comfortably. Now, here's the thing about that hyaluronic acid. You can front load it as much as you want, but it takes time for it to build up. We have to recognize, adapt to, and properly utilize, overcome to adapt to our internal environment. We just added hyaluronic acid to our internal environment. It's going to take time for that recognition to happen. It's going to take time for that adaptation to happen. I would bet, just based on my own personal experience, and by the way, I when I have a chance to recommend something that I personally do, I'm all on it. When I have friends, family, patients that I've been working with for a long time who all tell me I've had such and such an experience, I'm happy to recommend it. When I read something in a textbook, when I read the product bio, I want to learn a little bit more before I start to recommend it so liberally. I'm comfortable with the HA plus because I take it myself. The comments from the field, you talk to enough patients, enough people who shop here and start getting people's feedback, and you take your own feedback into account. You might have to take 3 months worth of hyaluronic acid before your body starts to recognize it, adapt to it, and properly utilize it. So we have patients and customers and shoppers and nutrition aficionados who come in here, and they're at sale time. They're going to buy 4, 5, 6 bottles of HA plus. They're going to give it away as gifts. They're going to use it. Families are going to use it, and they're just happy to have discovered this product. We also have people who've used it for a month and say it didn't help me. I don't know what to tell you. I mean, I guess if we had this conversation, I was very clear. You're going to have to use this for a while before you realize the benefit. If we didn't meet and never had this conversation, nobody told you, let me be the first and say, hang on, be patient with it. So the hyaluronic acid is critically important to lubricate joints. We're thinking back about our hypothetical me hammering shingles on the roof, irritating multiple joints in my body, irritating sprain, strain, repetitive movements, multiple tendons, multiple muscles. We just address the rehab of the joint in a certain sense by lubricating it with the HA plus. Let's start to get rid of some of the inflammation. My two favorite anti-inflammatories, and once again, to make my list of favorites, it means that it's something that I use. It's something that I get tremendous benefit out of. Now, we could take a guided tour through our nutrition store, and because the place is so big and we have so much stuff in it, it's going to take a while. I'll bet you there are at least minimum 20 different products on our shelves that can be thought of as anti-inflammatories. Not every single one is for every single human being's chemistry. I'm giving you my report based on my success, based on so many of my patients having success with the similar products. One is turmeric. I'm going to split hairs between Nutritional Frontiers Turmeric Plus and Standard Processed Turmeric Forte. The reason why I like both of those turmeric products so much is, well, one, because of the nutrient density, that you really don't have to take a lot to get a lot of benefit, but they're both blended with either black pepper or fenugreek. And those two, the black pepper and or the fenugreek, help your body recognize, adapt, and over absorb the turmeric far more efficiently than turmeric without either of those two co-metabolites or cofactors. My other favorite anti-inflammatory is fish oil. I'm very partial towards the omega 3D that Nutritional Frontiers puts out because it has so much active ingredient. It's so richly populated. The DHA, David Henry Alpha, and EPA, Eric Paul Andy, are the active ingredients of fish oil. And if you're a label reader like me, you'll see that, man, what a high percentage of the actual fish oil is EPA plus DHA, plus it's fortified with the vitamin D. Now, if you come over to my deli shop and order a slice of cherry pie, and we give you some crust and cherry stems, you're not going to be thrilled. That's not what you expected, but it's a cherry pie. It's just not the cherry filling that you had hoped for. It's pits and stems. Fish oil is basically fish fat. Some of it, the EPA and the DHA, there's your cherry filling. That stuff, man, is it good for you? Man, does it address so many different metabolic, neurological, biomechanical needs and benefits in your body? EPA and DHA, it's healthy fat. But I told you I got a capsule full of fish oil. So if I'm putting the equivalent, the fish fat equivalent of cherry stems and pits in my capsule, I can sell it as fish oil. That's what it is. Doesn't mean it's good for you, but it's certainly fish oil in a capsule. So I like the omega 3D from Nutritional Frontiers simply because the heavy nutrient density of the two active ingredients. Now, those capsules are big. I'm not going to mislead you. They're difficult to swallow. For people who want good, high quality fish oil, but have difficulty swallowing pills and capsules because of the sheer size of them, Douglas Laboratories makes something called Opti EPA, Eric Paul Anthony, and Opti DHA, David Henry Alpha. Very, very similar nutrient density. The little gel caps are just so much smaller, so you take more of them, but certainly high quality, great nutritional product. All right, so we've lubricated our joints. We have gotten rid of some inflammation. Now what we got to do is we got to tight muscles to relax. We got to get that fascia to stop adhesing itself to the muscle. I like chelated magnesium and B complex, especially B6. So the chelated magnesium is a Douglas Laboratories product. It's a pure encapsulation product. It's a different brand. And Nutritional Frontiers puts out Mag Complete, which is also richly populated with chelated magnesium. What's chelated? Magnesium is magnesium. What's the chelated aspect? Well, when you have magnesium, you have a mineral. It's a rock. It's ground into a powder. Let's put the powder together into pill form or put it in some delivery system, right? How do we get it to stick together? Chelated means stuck together. So it's bound. So if it's bound with an amino acid. The amino acid is like when you bake a cake, you put eggs in it to act as the glue. The eggs, really not a whole lot of nutritional value of those eggs in that cake. Don't tell me you're eating a chocolate cake flavored omelet. That's not what it is. Just enough egg to act as glue, right? You guys on board with that? Right? So what's our egg? What's our glue when we have a magnesium? We use that amino acid, which is the building block of proteins. So you put that amino acid into your mouth, or you put that magnesium into your mouth to swallow it, and you start to immediately recognize the amino acid and start breaking it out, breaking it down in your mouth. And we don't wait until it gets to the all the way through the digestive tract and halfway out before we start to break it down. And I like to compound all of that to help tight muscles relax with a B complex vitamin, Super B Complete. Can't go wrong with that. So far, so good. How's our remote audience doing? Questions, comments, moral outrages? Okay. I love that. All right. So I should have checked in with IT Savant Phil a little bit earlier, but at the very beginning, when we talked about what is health, somebody in virtual land said mind, body, spirit, and I think that's something that, look, I'm a neuromusculoskeletal chiropractor. I have a tremendous respect for everybody's spirituality out there. I have my own spirituality, and if you want to discuss that sometime, that's something we discuss off campus, maybe over a cup of coffee or tea or a walk through a park. I don't really like to bring spirituality into my clinical practice, but at the same time, I don't want to deny how important it is either. Okay, so mind, body, spirit. No other virtual land Questions, comments, moral outrages. All right. So a minute ago, we talked about riding that bike. One has the memory for how to ride a bike. Haven't been on one in 37 years, but or it was 35 years by the example I set. But we're confident that person despite a 35-year hiatus, they can get back on a bike, figure it out, and ride. We're cool with that, right? Because there's brain body communication memory stored up to be able to ride a bike. Well, guess what? I'm standing on my top rung of my ladder, hammering that whatever it is I'm hammering into the shingle on the roof. Guess what I'm doing? I'm creating new brain body communication memories. Okay. I am taking this pattern and all of the injuries that go along with it. And by injuries, sprain, strain, repetitive movement, torquing of the joints, that rung of the ladder, creating a groove on the inside of on the bottom surface of my foot, creating pain, creating discomfort, forcing me to rock back and forth, forcing me to shift myself, putting myself at risk to fall. I promise you, I'm not, this is all hypothetical. I won't fall. I'll be here and work on Friday, but I'm creating new injury. Like it's great that I remember how to ride a bike, even though it's been decades, but now I'm creating memories for an injury. I do not want that. So what we do from a chiropractic perspective is when we make chiropractic adjustments, when we add the dynamic of the trigger point muscle therapy, when we add the dynamic of the proprioceptive neurofacilitated stretching, the PNF stretching, which disables the tendon reflex long enough to stretch the muscle further into its deepest ranges of motion, we are unwinding new injurious neurological memories, and we're trying to replace them with therapeutic memories. So we talked on Monday in deep detail about joint mechanoreceptors and muscle mechanoreceptors and the type 1 receptors that stimulate the brain into this feel good status, and they suppress the type 2 mechanoreceptors, which are actually nociceptors, which trigger the brain to feel harm. So the nociceptors start firing. Man, I'm standing on that last rung of the ladder, putting my weight into it. I'm destroying tissue at the bottom of my foot. I am activating nociceptors, which are telling my brain through a complex series of neurological pathways, it's time to perceive pain. Bad stuff is happening. Okay. My chiropractor, I have a very good chiropractor. His name is Dr. Philip Ross. It just so happens that he practices here. He's my colleague. I'm happy to have him. He's going to make adjustments on my body. Hopefully I can talk him into doing a little bit of elbow and some of the really tight muscles. If he's having that workaholic day, he'll do a little bit more for me, maybe, maybe not. But anyhow, what's going to happen is we're going to start to activate the joint mechanoreceptors, the muscle mechanoreceptors, which are going to suppress or inhibit what I feel from the nociceptors that are telling my brain to feel harm. So we took a deep, deep dive into that on Monday. And today, what I'd like to talk about a little bit more is some very condition-specific nutrients that maybe we don't do a good enough job talking about on our normal day-to-day in order to affect that brain-body communication in a way to generate healthiness, to feel good, as opposed to that nociceptive dominant status where we hurt. So far, so good? Right now. Okay. The question is, when are you going to do that? And the answer is right now. Okay. Are we in a rush? I'm talking as fast as I'm ready to auction. No. We're going to do that right now. I mean, I think I've been talking pretty fast, and I haven't even touched my drink yet. This is uncommon for me. I feel like an auctioneer. I'm gonna, and we got delicious lunch out in the parking lot. Anybody do I hear? All right. Anyhow, so we're good. All right. So when we talk about these nociceptors, what activates them? Certainly harm of mechanical compression, injury, repetitive movement, but also barometric pressure, the temperature, the external environment. We have to recognize, adapt to, and overcome our external environment. So people will say, my knees really hurt. I can tell it's about to rain. The weather changed. Yup, you were right. You were right. That's what does it. So we want to do things that will alleviate pressure in our bodies and will shift our pH to a little bit more alkaline and a little bit less acidic. Okay. So one of the important things to do is we want to take antioxidants in order to help our bodies cope with that pH imbalance. And Nutritional Frontiers puts out 4 different colored drinks: the reds, the purples, the oranges, and the greens. You cannot go wrong. All of them, yes. Okay, somebody just raised their hand to say that she put a suggestion box as mixing all 4 colors as one. Um, a rainbow. The rainbow antioxidant drink, and Jamie's working on it. So you're actually a step ahead of me. Okay. Uh, mhm, mhm. I mean, as if there's not enough reason to come hang out with us. We have a juice machine where you can sample all 4 of the color drinks, but you cannot go wrong with any of those 4 antioxidant drinks. But I'm going to highlight the greens for a very specific reason. Is those green leafy vegetables are so important to alkalinize your digestive tract, which is where we produce our neurotransmitters, which is where our immune system lives when it's dormant, waiting to fight. Like 75-80% of our immune system lives in the digestive tract. And the greens also have the chemical structure of green leafy vegetables is remarkably similar to magnesium. So as I sit here and tell you, I think magnesium is so important for muscle relaxation and muscle calming down. The greens have a similar effect. That the reds, I mean, I'm shameless plug. Look, I got reds and protein in my drink. I'm a big fan of the reds. I'm a big fan of all of them. But for the purposes of our conversation here, I want to highlight the greens. Green leafy vegetables will help to calm down the sympathetic nervous system, that will cause a greater threshold for the sympathetic nervous system to activate and allow us to be more parasympathetic. What does that mean? Our nervous system can be subdivided into 2 categories: fight or flight, that's going to be sympathetic; wine and dine, that's going to be our parasympathetic. That's our non-voluntary nervous system. If I ask you all to wave goodbye, if I ask you all to do that same foot exercise that we were doing a couple of minutes ago, that's all voluntary stuff. You can do that if you want. You don't have to, but you can. If I ask you, dilate and constrict your pupils, please. I don't know if you can do that without some sort of external stimulus. I have to shine a light in your eye. Maybe we'll get to that point where your eyes will dilate and constrict, your pupils will dilate and constrict. External stimulus, adaptation to the environment. That's non-voluntary stuff. The sympathetic nervous system, like, we're all wound up. If somebody is in pain, if somebody has a little bit more acid than a little less alkaline than they would normally want, that sympathetic nervous system is on. That sympathetic nervous system can very loosely be associated with an increase in cortisol. Cortisol being the stress hormone, of course. How do we diminish our cortisol levels? Well, we got to turn down the sympathetic nervous system just a little bit and maybe turn up the parasympathetic nervous system. Make sense to you? Yeah, absolutely. What's something that we can do to dial down the sympathetics, or basically raise the threshold that it would take to get the sympathetic nervous system fired up? Well, one thing is deep breathing exercise, very similar to the deep breathing, in fact, identical to the deep breathing exercise that we did at the very beginning. We're going to do that deep breathing. And when I ask you very politely to invest a minute, 5 times a day, 8 times a day, to sit in perfectly good upright posture, so good that you would impress me with it, and breathe in through your nose, use your diaphragm, not these muscles here at the bottom of your neck. We're going to be dialing down the threshold to have a sympathetic state. What else can we do to inhibit cortisol? Well, testosterone and cortisol are on a continuum. If you have too much cortisol, you're not going to have enough testosterone. So they're moving in kind of an inverse sort of degree. Now, there are a number of products on our shelves in the nutrition store that would help you increase your testosterone. Ashwagandha would be a good choice that not a lot of people talk about. I don't know if anybody's mentioned ashwagandha in a presentation here. I know that plenty of those metabolites get good press. We don't talk about that enough. We don't talk about green tea enough. Another possibility, instead of thinking about what am I going to do to pump my testosterone up, Testosterone and estrogen are on an inverse continuum. So, what if we took the Nutritional Frontiers product, the Estro Cleanse, to wash away excess, unwanted, and this is not gender specific. This is everybody. All of us have a balance of testosterone and estrogen in our systems. And I was talking to somebody in preparation for this conversation thread, and she said, "Well, I've had so many parts removed that I don't have either anymore." Well, yes or no, maybe so. I doubt that very much. And even if you reach a chronological age and a physiological age where you don't produce estrogen anymore or you're not producing testosterone, that doesn't mean there isn't some in your body that hasn't outlived its half-life, and you still have it piling up somewhere. You just may not be using it appropriately. Might be triggering a cortisol buildup. It doesn't mean you can't get rid of it a little bit faster. So I like to recommend the Estro Cleanse as one of those. Look, I think that's a subject of one of our presentations for one of our nutritionists. I think one of our nutritionists talks much more about the Estro Cleanse than I do. But if you want to suppress cortisol, you certainly want to raise your testosterone. And if you want to raise your testosterone, you have to get rid of unwanted estrogen. So the Estro Cleanse is a good bet for that. Now, so far so good. I'm about to go. Yes, question. Yes, de Quervain's, de Quervain's tenosynovitis. That means that is an inflammation of a tendon. De Quervain's, I believe that's hand and wrist, but de Quervain's tenosynovitis is the question from the virtual world. And when one has an inflamed tendon, there's a very very good chance that the muscle that attaches to it is going to be tight and spasmed, and there's a very good chance that the bone that it attaches to is going to have limited range of motion at the joint that it operates on. So we certainly want to think about right back to that hyaluronic acid, the HA plus. We want to talk about that turmeric that we mentioned, the fish oil, the magnesium, the B complex vitamin, and probably some trigger point, especially treatment in the muscles that attach to the tendon that is challenged with the de Quervain's. And we certainly want to talk about mobilizing the appropriate joints. So de Quervain's tenosynovitis is really a very specific example of the very generic example that I gave of, well, let's hammer that shingle in place. So, and thank you, IT Savant. So, anyhow, I want to bring up one last point before the next speaker shoos me away. And that is, we want to talk about the cell membrane, that every single 100% of your cells in your body have a membrane, and that membrane is kind of fatty, and it just has pores in it that allows certain things to pass through and out and prevents other things, metabolites, from getting in. And that cell membrane, we talked about it having to be just slightly negative. And we think about the more alkaline the body is, the healthier the cell membrane is going to be. So, one thing that we actually have to reinforce our cell membranes is fish oil, omega 3 fatty acids, fish oil, omega 3D, Opti EPA, Opti DHA. You see how, if you want to really think and drill down on what I'm saying, the same products keep coming up over and over and over again because they serve so many different purposes within the human body to keep that cell membrane going and pumping bad stuff out, preventing bad stuff from getting in, allowing good stuff, good food to get in. We need two more things. We need to have ATP pumps that are metabolically active. The pumps are like a power station in the cell to pump good stuff in and to pump bad stuff out. So you got to have ATP. So to make ATP, we're going to take two ingredients that we really don't talk enough about here. One is going to be the power fuel. I don't recall a lot of presentations during our wellness week addressing power fuel. The principal ingredient there is called D-ribose. It's a sugar. We want to stay away from sugar, not all sugar. The D-ribose is a sugar that's very healthy for the heart, and it helps us to produce ATP, adenosine triphosphate, which is the energy currency that the body uses for, if nothing else, to maintain those cell membrane pumps. The other ingredient that helps us produce more and more ATP, also very heart healthy, also a potent antioxidant, helping us produce the ATP, is coenzyme Q10, the power Q, the Q in all. Nutritional Frontiers product, we talk about that power cue as something like if people have heart disease or heart challenges, or they have circulatory problems, or the heart pump isn't working up to full threshold, we encourage them to take coenzyme Q10. If you want to prevent those problems, we encourage you to take coenzyme Q10. Well, think about those pumps in each and every single one of your cell having similar properties on a microcosm level to what the heart does, right? So the cell wall, the cell membranes, the cells have pumps in them too, and those pumps are partially fueled by coenzyme Q10. So that officially leads me to being over my allotted time slot. Yes. Oh, thank you. The question is, if one is a vegan, what is a good fish oil supplement? Yes, the answer, flaxseed would be a good appropriate. I can't call it a straight one for one substitution, but I can certainly say that flaxseed will help pick up some of the slack that the fish oil, the absence of the fish oil, is creating. Now, I don't, just as I like to leave everybody's spirituality to them and like off brand time, I'm happy to discuss and we can chat, but it's not a clinical concept to me. Like, I don't, you want to be a vegan, be a vegan. You want to be a carnivore, be a carnivore. I mean, I love you either way. I'm not gonna try and influence anybody's diet. I mean, I want to influence you away from the Burger King. We drove them out of business. Coming for you, McDonald's. But I know plenty of people. I have plenty of patients. Dr. Weiner was a vegan, and he, he attracted vegans. So we have a big vegan representation here amongst our patients, amongst our fan clubs, amongst the people who shop here. And that's well and good. But I've met quite a few people who identify as vegans and take fish oil. So if one is a vegan and they're taking fish oil, they didn't surrender their vegan card to take a fish oil gel cap. If one has a moral or dietary opposition towards fish oil because of their vegan identity, take flax and try and get a little more turmeric. So I want to thank you all very much for your kind attention, for your wonderful participation. And I wish you all as much safety as possible and as much good health as possible. And this is Wellness Week 101. That means there have been 101 of these. I've been here for 15 and a half years, ballpark. So I've seen a few. I'm looking forward to talking with you guys again at Wellness Week 102. So go ahead and sit on the edge of your chairs waiting to hear what I have to say for myself. Thank you so much.